recurrent white discharge. So white discharge in a woman from the vagina is quite common and many a times it is normal. In the whole of menstrual cycle, the white discharge can vary. In the initial period, it will be white, and in the mid-cycle, that is during ovulation, it will be watery like a mucus, and in the post-ovulation period, just before the periods, it will be thick and white. And in all these times, it will be odorless, that is without any smell. So when a woman complains of white discharge, so there are three things which are important. One is whether the color is not white, that is whether it is yellowish, greenish, whether it is smelly, that is whether it is causing very bad smell, and whether it is causing itching. So if there are these three symptoms, then we think of infection. Otherwise, there is usually no infection. The white discharge is important to clean the vaginal old fluids and to make the vagina not dry. So if there is white discharge, so there are 2-3 infections that we need to rule out. The commonest being the fungal infection or the yeast infection as we call it. So this yeast infection can cause thick white discharge like a curd or a greenish discharge with a very bad smell and which causes very severe itching. The infection, if it happens more than 3 times in a year, then we call it as recurrent white discharge. Either it could be because of no treatment or incomplete treatment the first time, or it could be repeatedly the woman may be prone for getting the infection. So consulting your doctor when you have these complaints is important to cure it completely. If at all, if you have white discharge, the commonest treatment that we give is antifungal vaginal pessaries and symptomatic relief for itching. And the course should be completed. If the course is stopped in between, when the woman feels a little better, then the infection can flare up. And majority of the times, women who are prone for vaginal infections will tend to have diabetes or borderline increase in the sugar levels. So she has to get her sugars done, and also she has to improve her immunity. That is by taking probiotic foods like curds, like almonds, and like avocado. All these will improve the immunity of the person, which can prevent infection. So coming to repeated white discharge as to how we treat it, we usually give them a longer course of antifungal treatment, and also we tell them to keep themselves hydrated very well, to drink lot of fluids which can detoxify the body, and also for them to be stress free and to use barrier protection while having intercourse. So if the partner has infection, then the woman can get infection from the partner. So sometimes we have to treat both the woman and the partner to have a complete cure.